Hi everyone, this is Yijun. Today my topic is cardiovascular diseases during COVID-19 pandemic. Let's first talk about some general background of cardiovascular diseases. It is the class of diseases that involve the heart or blood vessels. It is also the manifestation of systematic vascular disease in the heart and in the brain. Here are some examples of the cardiovascular diseases: the atherosclerosis, the hypertension and other hemodynamic factors, the hyperlipidemia or the blood component factors problems such as the amnesia. What causes atherosclerosis? Atherosclerosis, it is the most common kind of the cardiovascular diseases. It is because of the increased sympathetic activities that will lead to the chronic negative effects on the heart and blood vessels. Both the acute and subacute stress activate the adrenergic system, increasing inflammation and endothelial dysfunctions, leading to an increase in the atherosclerotic plaque. The reason for increased rates of cardiovascular diseases during the pandemic. So, the COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and social work. In addition to some medical complications and psychological support, in regarding to the high infection rate from the respiratory tract, people usually must to keep social distance and take isolation. However, keratin is associated with stress and depression, leading to unhealthy diet and reduced physical activity. These restrictions will strongly influence lifestyles, leading to an increased burden of cardiovascular disease during the COVID-19 keratin. During this special period, additional stress was caused by prolonged keratin during the COVID-19, like frustration, disorder eating, lack of physical activities, or the economic loss. The first one is the frustration. It is caused by the long time isolation at home or at hospital, and the emotion will become more sad than before. The disorder eating, it is a disturbed and unhealthy eating pattern that can include restrictive dieting, compulsive eating, or skipping meals. The lack of physical activities, it is very obvious, so maybe lack of the outdoor activities and eat more fast food at home will cause the obese. And the economic loss pressure, it is due to the less job opportunities and the increased rate of unemployment and less money storage for support. Keratin is associated with a diet poor in fresh fruit and vegetables. However, it is known that higher vegetable intake is correlated with lower anxiety and fear severity. So, a healthy diet will cause the psychological problems, and it has many complications, and higher consumption of poultry and high-fat dairy products was positively associated with greater anxiety symptoms. So I have a question: why do high-fat dairy products become more accessible than before during the COVID-19? I will answer it. It is only to the anxiety surrounding future food shortage. People will purchase packaged and long-time food rather than the fresh food, and this leads to an unhealthy diet poor in antioxidants. So why the real food it is more healthier than the packaged food? It is because that the real food is packed with the antioxidants and nutrients that support the heart health, including magnesium and healthy fats. Eating a diet rich in nutritious, unprocessed food may also help reduce inflammation, which is considered one of the major drivers of the heart disease. So the packaged food it is less nutritious and it will cause the cardiovascular diseases in some ways. This food will destroy your willpower. The risk of obesity. Obesity is associated with an increased risk of developing cardiovascular disease, particularly heart failure and coronary heart disease. These mechanisms through which obesity increase cardiovascular disease risk involve changes in body composition that can affect the hemodynamics and alters the heart structure. Obesity has some detrimental effects on immune systems that include alterations in leukocyte development, phenotypes, and activities. And in addition, obese individuals require more blood to supply oxygen and nutrients to their bodies, which causes an increase in blood pressure. Your body will also require more pressure to move this blood around. In, so, it is also a very important reason to increase the cardiovascular diseases possibility. The recommendations and the suggestions. So we need to confront and take action for the reducing negative emotions, lifestyles, and potential cardiovascular diseases during the COVID-19 self-isolation. For example, some applications may help the control of diet and to maintain healthy weight. And the Online exercise classes and video or app guided aerobics training at home can be a simple and economic tool for performing physical activity. In addition, here are some food recording applications that will help you to keep a healthy diet. And here are many dietary recommendations for you, and it is very useful and convenient. In addition, the social support improved the use of these tools for adopting a healthy lifestyle, and social and public health support is also very important. Global action supporting healthy diet and physical activity is mandatory to encourage people to return to a good lifestyle. In addition, some public health nutrition assistance services need to be financed more than before at this time. Finally, I will introduce some dietary suggestions to lower the cardiovascular diseases. The first is eat more fruits and vegetables. Vegetables and fruits, like other plants or plant-based food, contain substances that will help prevent cardiovascular disease. Eating more fruits and vegetables may help you cut back on higher calorie foods such as meat, cheese, and snack foods. The second one is choose food low in saturated fat, trans fat, and sodium. The food high in saturated fat or trans fat is very harmful for the body composition, and it will have many complications for diseases like the high in cholesterol, high in blood pressure, and increase the cardiovascular diseases. Um, the third one is to choose the heart healthy diet like whole grains, fish, lean meat, seeds, and the legumes. And the diet is especially important factor in the risk of atherosclerosis and heart disease generally. And consume plant-based fruit to lower the heart disease risk. It is also very significant for future development. Thank you so much. This is all my presentation.